Hello everyone. See you again. This is my second week summary of MOOC Cleft, Lip and Palate. So for second week, I already received lecture from Dr. Puneet Batra, Prof Kikelomo Kolawole, and Dr. Paa Ekow Hoyte-Williams about PNAM and also about cleft rhinoplasty. So my resume will be PNAM, pre-surgical nasoalveolar molding, is a pre-surgical management to improve initial deformity as first stage of orthodontic management. Timing is very critical because of the high hyaluronic acid on neonate blood due to high estrogen. This PNAM is firstly introduced by Hoffman on 1689. The objective is to improve surgical outcome by restores pre-surgically of skeletal, cartilaginous, and also soft tissue relationship. There are two types of PNAM, which are active or passive, with or without strap. So, by making alteration of the negative sculpting, it will allow alveolar processes grow passively. The popular impression material used for PNAM is silicone, and we use customized tray. We do it when infant fully awake, and the infant should be able to cry and do nasal breathing. It lays in supine position in mother's lap, and operator from 10 o'clock position. Don't forget to monitor oxygen saturation of the infant. Or we can do the Grayson technique. We must recheck and relieve maneuvers to prevent airway obstruction and later infection. So goals for NAM in UCLP are align intraoral alveolar segments, correct nasal cartilage, nasal tip and alar base, also correct position of columella and filtrum. And for goals of NAM in bilateral cleft lip and palate are lengthen the columella and then reposition of apex of alar cartilage towards the lips, and then align alveolar segment and premaxilla to form normal maxillary arch. So for the first visit, we must reassure parents and we reinforce feeding instruction. We do taking impression of an intraoral cleft defect, and also we do tape the lips after the impression is taken. So for UCLP, we can use single wire and double wire for BCLP. And for the second visit, when the PNAM is ready, the appliance, we should teach the parents first how to insert and remove the appliance. And then we should observing are there blanched tissue when the appliance is used. And then for the instruction is to wear 20 hours per day, include during feeding, and to clean plate once daily, and also clean baby's mouth. The NAM appliance can be held with the help of denture adhesive and also elastic, which applied to the cheek. And about rhinoplasty, I learned that the primary rhinoplasty, which means it this done at the same time as cleft lip repair. There are 3 types: closed tip, semi-open tip, and open tip. The goals are reposition nose to anatomic position, asymmetric both alar domes and also tip projection, correction of the columella deviation and also length, and moving alar more medially and nasal floors more symmetrically. So the closed tip is the most commonly used for rhinoplasty. We use sharp pointed scissors which pass through lip incision. And there is Tajima incision or reverse or inverted U, which used in semi-open. It is effective in improving nostril height and alar web, and it can also lengthen the columella. So with the semi-open technique, it achieves more improved aesthetic outcomes. And with the placement of the interdermal suture, it can reposition displaced cleft site a little higher. I think that's all for my second week resume. So see you next week on my third week resume. Bye-bye.